In this video, I'm going to be going over Frankie and Alice, which is a movie directed by Jeffrey Sachs and encompasses a young woman who experiences dissociative identity disorder. Throughout the movie, the main character, Francine Murdoch, also known as Frankie, is the main character and the main alter identifying with the body. She is a 32-year-old black female who's right-handed and has the IQ of 132. Her occupation is an exotic dancer in downtown Los Angeles, and she is known as one of the best dancers in the club. Also, as an alter is Alice. Alice is the alter fighting for control of the body. Her age is unknown and she's a white female. She's left-handed with IQ of 102. Her personality is formal and proper with a snappy attitude and a very southern accent with traits of racism. Lastly, her other alter is Genius, who is a childlike alter that only gets triggered during moments of strong emotions. Genius is around the age of 8 years old and has foresight, being nearsighted, and has speech of a child. Brought throughout the movie, Genius is triggered with a switch through light hypnosis therapy. Also in the movie is Frankie's psychiatrist, Dr. Joseph Oswald, or Dr. Oz. Dr. Oz is the psychiatrist treating Frankie at Pierce Psychiatric Hospital. The reasons for her admissions were blackouts, violent behaviors, and unexplainable behaviors. Like one part of the movie, she ends up uninvitingly going to a wedding to someone who she no longer is involved with, and that causes a scene. The types of therapy that Dr. Oz works with Frankie with is sedative-induced light therapy, hypnosis, and the areas he focuses in on are bringing out all possible alters and piecing together Frankie's blackouts. A little summary of the movie. The movie starts off with Halle Berry, who plays Francine Murdoch, a young black woman in LA who works as an exotic dancer and is popular with the men. The movie starts off in Savannah, Georgia in 1975 with a car crash and a young girl, then forwards to present Los Angeles in California, 1978. After an altercation that ended in Frankie curled up into a ball in the middle of an intersection, dazed and confused, Frankie is placed in the care of Dr. Oz at Pierce Hospital. After working towards treating Frankie and her blackouts, Dr. Oz diagnoses her with dissociative identity disorder and 3 distinct alters. The story ends with Dr. Oz treating Frankie until she's able to control her alters, and in due time, he is able to help Frankie understand what is going on and the reason for her alters. From what we know, in the DSM-5, according to the DSM-5 on the National Library of Medicine, the Diagnostic and Statistical Manual of the DSM-5 criteria for DID includes at least 2 or more distinct personalities. Each personality varies in behavior, sense of consciousness, memory, and perception of the outside world. Persons with DID experience amnesia, distinct gaps in memory, and recollections of daily and traumatic events. They cannot be directly related to substance use or part of a cultural norms or practices. Importantly, these symptoms must cause notable lack of daily functioning. Applying what we know from the DSM-5 to the movie, in the movie it states that Francine L. Murdoch has 2 other alters aside from her main personality, which is Frankie. Which identifies with the body. Each alter varies drastically in all categories required by the DSM, mostly seen in the childlike behaviors and speech of Genius and the racist perception of the outside world by Alice. Frankie's blackouts can also be categorized as amnesia, memory gaps, and at times even dissociative fugues. Also, multiple times throughout the story, Frankie states she does not use any form of use anything aside from a little smoke now and again or any hard drugs. Frankie's signs of DID. Frankie first gets triggered by a child's toy in the very beginning of the movie, when entering the apartment of a man she's with and seeing a baby's crib. Frankie zones out and switches into a violent, fearful, and confused personality, which later we find out is her alter Alice. This switch and episode ends with her running into the street and laying in traffic, very overwhelmed and fearful. Throughout the movie, Frankie mentions getting mixed up often. She experiences things like spending large amounts of money and then forgetting about it, like buying fancy dresses and stuff, and having no recollection of that. Zoning out, hallucinating children, and having visual flashbacks. Frankie's alter Alice also engages in self-harm behaviors like banging her head against a mirror to end a switch. Overall, I think that this is a very, very well written and directed movie. Halle Berry does an amazing job at portraying Frankie Francine Murdoch in this true story. I think it is a very accurate representation of dissociative identity disorder and does a great job at depicting symptoms. I also think that the film did a good job at recreating the true story and the experiences of Frankie. I definitely would recommend this film to anyone wanting to learn more about DID. And my references are below.